Hey, Wellness fam. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. I hope you all are doing well tonight. I wanted to welcome you to November. It is the month of November. Can you believe it? The month where we are giving thanks, in the month where we think about the things that we are thankful for and grateful for. So, before we move any further into this broadcast, I just want to say I am grateful for you all. I am thankful for each and every one of you who join every Wednesday that we are here. I am grateful for those of you who shared the lives, who have shared my information and my practice information to your family and your friends and your colleagues so that they are getting the best health care that they can. I am thankful for this platform that allows me to come on and do what I love each and every Wednesday and to share the information that I have and that is given to me to make sure that my friends, family, and community and my patients are creating a legacy of good health. And so tonight we're going to continue in the vein of making sure that you are creating a legacy of good health. And how do we do that? One of the things that I talk about so much is making sure that we are proactive in our health and taking proactive steps towards making sure that we are healthy. And so tonight we're going to talk about that. November is here. It's time to start to wind down our year. Many individuals begin to prep for their new year in October. Some people are last minute. I don't know about you, but I like to try and plan ahead. But this year has just gotten away from me. And so here it is, November, where we're winding down. The holidays are upon us and our routines start to shift. But before we go into full holiday mode, I want to make sure that you take a pause, that you take some time to stop and take charge of your health. It's not too late. If you have not scheduled your annual health exam, annual wellness exam, you still have time to do that. Many individuals have HSA funds that they need to utilize. Look at ways and things that you can use those funds to benefit yourself. I don't know if you know that there's a website, hsa.com, that lists a lot of items that you can purchase for health and wellness purposes that can help you and that you can utilize those funds. So don't lose those funds and don't end this year without scheduling your annual wellness exam and making sure that you're following up on your health and making sure that you're being preventative. We've got 2 months left in this year, and there's more than enough time to make some real progress towards your goal. So, have you set a goal? Were you able to reach that goal? I'm not one that does New Year's resolutions. However, there are many people who start off their year gung ho, they're excited, they have a lot of energy in regards to their goals and their resolutions. And then the flame fizzles out and we get busy and we forget all the things. And I'm guilty of that myself. And so tonight we're just going to focus on some of the things that we might need to do before the end of the year. So tell me in the chat, you're watching live, even if you're watching the replay, just retype replay and then respond to this question. What's one health goal that you've been putting off this year? Is it your checkups? Is it better nutrition? Is it fitness? Or is it rest? I know for me, all of those were on my list of things that I wanted to take care of. And one area that I could really focus on and that I'm really looking into right now is nutrition. I've got the exercise down. I've gotten my physical exams completed. I had my mammogram. All of those things are done. And I'm slowly but surely working in the rest factor, right? Because we know that rest is not a luxury, it's an essential. And it's something that we all need to do. So I'm definitely making sure that I'm putting that into my schedule. However, when it comes to my nutrition, I know that I can do better. And so that's one of the things that I am going to this week make an appointment with a nutritionist, so that I can make sure that I'm maximizing the things that I'm doing and that it's full circle with everything. I can have the exercise down, I can be resting, I can be doing all the self-care things, I can be up to date on my physical exam. However, if my diet is trash, which is not, but I do feel that I could do a lot better with my diet. And so that's one of the areas where I'm really working on. And I still have time. It's November 5th. And so I have a little over a month to get it done. So we're going to take care of that. All right, let's see those emojis rolling in. I want to see those comments. I want to see the emojis. I want to see how you are responding to that question. And if there's anything that you still have not gotten done yet, don't be ashamed. Share that in the chat. Maybe someone else can provide you with some encouragement, or maybe you can encourage someone else to go and get their annual wellness exam. Again, I'm so grateful for each and every one of you. So, you guys know I love my statistics, and I wanted to find out if you guys knew or realized that 6 out of 10 adults in United Health live with at least condition, one chronic condition like heart disease, diabetes, high blood pressure, one chronic condition. And the effects of those chronic conditions can impact that person's entire life. And here's the thing, 80% of premature heart disease and strokes are preventable. Meaning we can do something about them. If we catch the symptoms earlier, we can make sure that we're making those lifestyle changes and routine care. So when I talk about taking charge, I mean knowing your numbers, getting your screenings, and not waiting until something happens or something feels wrong to get checked. Many times we'll, experience some symptoms in our body and we'll blow it off as, oh, it's just heartburn, or, oh, it's just a tension headache, or, oh, it's, just this, or, I'm just stressed and that's why my blood pressure is up, or it's, this, or it's that, when it could be something potentially serious. And so we have to really take that for what it is in the moment. So know your numbers. And what numbers am I speaking of? Your blood pressure, talking about your cholesterol, your blood glucose, and your A1C, your BMI, and your waist circumference. These are all important numbers to know, particularly your blood pressure, your cholesterol, and your A1C, and your BMI. Again, some people ask, I've had the question like, can I trust the BMI, that measure? And I say it's the starting point. It's not the holy grail of things when it comes to your weight, because I feel like the BMI scale is a little biased. I'll just put that out there and leave it. We're going to close the box and move on. But knowing your numbers and where you fit, because for me, let's just circle back to BMI. So when we talk about BMI, according to my BMI, I should weigh 161 pounds. Right now, I'm 190 pounds about. That means I need to lose 29 pounds in order to meet the goal weight according to BMI. For me, I tend to feel my best when I'm around 185, 190-ish. That's when I feel good in my body. So I say, when I'm talking to a patient, especially someone who's looking to lose weight and things of that nature, I say a weight where you feel good in your skin and where you feel good in your body and where your numbers line up, the blood pressure, the A1C, all of those things. So what are some common screenings that are missed? Common screenings that are missed, and these are for women and men, but pap smears. Women between the age of 21 and 65 should have a pap smear. And again, the frequency of those pap smears will vary depending on the current health history. Any abnormal paps in the past, any abnormal bleeding, any signs and symptoms, what have you. So based on your age and your health history, and the conversation with your gynecologist or primary care provider will determine whether or not the frequency aligns with CDC measures and things of that nature. Mammograms, starting at age 40, every woman should have a mammogram. And recently I had a patient ask about a thermal mammogram, and I had not heard much about those, but I did do some research on it. Screening mammogram should be the way to go. It is the gold standard. And as we talked about previously, we just came out of October, Breast Cancer Awareness Month, and we're not just going to skim right over that. We're going to continue to talk about that. But knowing when you should be getting these screenings, colonoscopy starting at the age of 45, and sometimes even earlier. And if you have been here with me for some time, I had several GI nurse practitioner specialists here with me and they talked about some of the different screenings and when those things should be done. And so if you have a family history of colon cancer at an early age, or colon cancer in general and a first degree relative, then you might have to get screened a little earlier. I also had a conversation with several patients this week in regards to gold standards, which is the colonoscopy, versus Cologuard and the FOBT kits. And so I know patient preference is important, but also understanding when and what types of screenings to get. So it's important that we look at some other numbers and when those things are missed. We talk about the blood work, so your lipid panel, which talks about your cholesterol, your LDL, your HDL, your A1C numbers. These should be done annually. And typically, I will start drawing blood work on patients routinely around the age of 18, depending on the situation. But for those individuals who are over 35 or with any risk factors. So if I have a younger patient that has some risk factors, of course, we're going to check their lipids. We're going to check their A1C just because we want to know what's going on with them. They have a parent who has numbers that are high, we're going to be trending and monitoring them. Early warning signs to watch for: unexplained fatigue, frequent thirst or urination, slow healing of wounds, mood changes and irritability, and then sudden changes in your weight or your appetite. And many times the questions that I will ask is, have you had more than a 10% body weight loss or gain unintentional within the last year? And so that will tell me whether or not there's potentially something going on. So I want you to drop a heart in the chat if you've had your labs or screenings done this year. I want to see how many hearts I can get. And again, if not, no shame. You still have time. And this is your reminder that your body deserves that care. Your body is worthy of that care. So let's talk about a few things that we can do when it comes to self-checks and things that you can start doing at home to make sure that you're staying proactive in between appointments. So some simple self-check habits. And again, you don't need any fancy equipment. You don't need a degree in medicine or be a nurse practitioner to take charge of your overall health. So let's do a quick self-exam audit together, right? I want you to grab a notebook. So I'm gonna give you a minute to go grab a notebook and then just answer any, or you could just answer in your head or turn on your voice recorder, what have you. So when was the last time you had a checkup or your lab work? How many hours of sleep am I actually getting? And you know what? I don't have mine on right now. But many of us have smartwatches, and those things can track a lot of things, including our sleep. It can tell us how many hours of sleep we've had, what level of sleep we're at, whether it's REM, light sleep, deep sleep, what have you. It can tell us how many times we woke up, if we're not breathing properly, tell us all the things. So utilize those devices that can help, right? And then how often do I intentionally move my body each week? And you guys know we talk about this all the time. 30 minutes of moderate intensity exercise 5 days a week for 150 minutes of exercise. And then am I drinking at least 64 ounces of water a day? And I say that with this caveat, that if you have anything going on with your heart, your kidneys, your lungs, anything that will, and you've been told by your healthcare provider to monitor or limit the amount of fluids that you're taking. I want to put that out there because many times you'll hear me say we should be drinking at least half our body weight in water. And that's true for healthy individuals who don't have any comorbid or any conditions that would prevent them from doing so. So I do want to put that out there because I did get a inbox from someone asking me that question. They wanted to follow the advice that I was given. However, they had a specific situation going on. And so I did, explain to them, if you have issues that would prevent you, or if your healthcare provider has told you not to do a certain thing, then I need you to follow the advice of your healthcare provider. Or if you're looking to start any of the things that I'm recommending, which is a recommendation, I always recommend that you follow up with your healthcare provider before starting anything new. And that's with anybody. If you see something else on social media, if you read something in a magazine or on a post or something like that, and someone's recommending some type of supplement, vitamin or drink or what have you, or exercise, then you want to make sure that you have that conversation with your healthcare provider. And if you had to pause, or if you weren't sure, or if your answer was no to any of those questions, again, you still have time. You still have time. And moving our body could be just as simple as sitting in our chair when we're at work and we're doing some shoulder stretches, kind of moving your shoulders back, moving them forward, lifting your arms, stretching, things of that nature. It doesn't take, these extensive workouts or stretches to be able to move your body. If you're in an office setting, when you get up and go to the restroom, make a loop around the office, or, go the long way to get to the restroom. Those are ways that you can get your body moving. However, that's not going to get your heart rate up. If you have some stairs and your knees are okay and your heart is okay, maybe take the stairs and jog up and down a couple of times throughout the day. That's going to get your heart rate up. That's going to help you get some cardio. So the key is that movement is medicine. There's a new phrase, and health is wealth. Your health is your wealth. You can have so much money. You can have all this money in the bank, but if your health is not where it needs to be, then you're not going to be able to enjoy that money. So movement is medicine. It boosts your mood. It improves circulation and energy. So even if it's just 5 minutes, give yourself 5 minutes to start with if you're not into a routine of working out frequently. I had a procedure on Monday, and so I had to take it light. So I haven't done much of anything except for walking my dogs and walking throughout the house. I'm feeling a lot better today. And so I will start back my routine tomorrow, but I have to go slow and get back to my routine. So here's what we talked about today and some of the key points that I want to leave with you. That prevention and preventative care saves lives. Many times when someone comes to their provider goes to the hospital emergency room and they've been having symptoms for a while, usually, and many times, not usually, but oftentimes or many times, their condition is at a greater stage or a later stage than if they had gone in earlier. Knowing your numbers is empowering, right? If you know that your resting blood pressure, your blood pressure is 110/70, and you go and you get a blood pressure check done and it's elevated, then you already know what your baseline is. So for me, I stress knowing your baseline. And then small, consistent actions create real changes. I'm not telling you to go out and start a new workout plan tomorrow where you're lifting weights 5 days a week. I'm telling you to start slow and slowly increase. You still have time. Don't wait until the new year's to set a resolution. You can reset right now. You can start those small little changes right now, whether it's setting your phone into do not disturb mode at a certain time at night so that you are device free. You're putting together a routine for bedtime. You're waking up in the morning and there's a water on the bedside so you can get your water first thing in the morning. You're stretching, you're doing all the things, you're putting the little things in place that are going to help you be successful. I just want you to know that for me, preventative care is so important. And as a healthcare provider, this week, I had the opportunity of being a patient. And I don't know if you ever heard this, but there's a phrase that say healthcare providers or nurses are the worst patients. And I beg to differ. I really beg to differ. And this week, I just want to shout out the nursing staff at Advent Health, Apopka, and the physician who did my procedure, who performed my procedure, and the nurses. One was Jamal and the other one was Enid. They were amazing. And so thank you. I'm grateful for those providers who were there for me when I needed to be a patient. And so this was preventative care for me. There was something that we needed to look at, get a better picture of, figure out what was going on, preventative care. And so I took those steps and I took those measures to make sure that I was doing what I needed to do for my body. And there will be follow-up, and I need to make sure that I'm following up and doing all the things. So we're going to close out tonight. And I just want to say, I want us to end the year strong. I want us to end the year making sure that we know what we're supposed to be doing. And if we haven't set that appointment this week or by the end of the year, that at least you've got it scheduled for January. And I can tell you that there are many providers' offices who are scheduling visits into June and July of next year because they're so full and they're busy. One thing I love about Wells Legacy Health and Wellness is that we have the flexibility and we have many times same day appointments available. So if you don't have a healthcare provider, if you have not had your annual wellness exam and you need to get that done before the end of the year, reach out to us. We'll get you scheduled and we'll get you seen. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. I'm so grateful for each and every one of you. Each day in the month of November, I want us to think about something that we are grateful for. And tonight, I'm grateful for each and every one of you. Stay safe and be well, and make sure that you're putting into place all the things that you need to do so that you can ensure that you are creating a legacy of good health for you, your family, and the generations to come. Stay safe and be well. This is Dr. Latoya Wells. Make sure you book your appointment, 321-306-6755. And you can also catch us on our website at wellslegacyhealth.com. Bye.